Hello, my name is Dr. Tulpule. I am a consultant in hematology and bone marrow transplantation, and I'm going to speak to you about blood cancers. So broadly, the blood cancers can be divided into those which grow slowly and those which grow very fast or are aggressive. The symptoms therefore depends upon the type of the blood cancer. So slowly growing blood cancers, usually patients are quite well and they don't have any symptoms. They could be maybe having a small lump, maybe say under the neck or under the arms, and does not cause any problems. Or on the other hand, they may have had a blood test where the white count is a bit high. When they go for blood testing for some other reason, for example, say check for diabetes, or they do a blood count or their annual blood check. Now, the symptoms in aggressive can be quite severe in some patients. So they can be lumps which grow quite rapidly. They can have shortness of breath. They can have abdominal pain. They can have weight loss, fever, drenching sweats, bone pains, renal failure. Sometimes patients get infections which are difficult to treat or take a long time to get treated. Sometimes there's bleeding like gum bleeding or nosebleeds and bruising under the skin. Now, most of the cancers, we don't know what causes them, but we have certain patient groups like those who are on long-term drugs that suppress the immunity, certain viruses like HIV, radiation, and certain chemicals like benzene, which are associated with blood cancers. Now, what can we do to prevent them? I would say a healthy lifestyle, so have adequate rest, cut down your stress by incorporating meditation and some relaxation techniques, cut down on your tobacco and alcohol, get some regular physical exercise. Now, the common cancers that we know, blood cancers, are the leukemias, the lymphomas, and the myelomas. And there is treatment for all of these conditions. And in most of these conditions, they are very well controlled, and a majority of them can be cured as well. Now, treatment is given by chemotherapy, which is by tablets and injections. The low grade or the indolent cancers can be treated as an outpatient basis on the daycare, whereas the more aggressive ones can be treated as an inpatient where they have to stay in the hospital. Certain patients require a treatment called a bone marrow transplant. Now, in this sort of procedure, there are two types: an autologous transplant where we take the patient's own cells, and an allogenic transplant where we use somebody else's cells. And here at Kokilaben Hospital, we have got a big unit, one of the largest in Mumbai, and we have got a multidisciplinary team which look after these patients very, very effectively. So my lastly word of advice would be, if you're not feeling well or you feel something is not right, please visit your local doctor, your GP or your physician to get a physical examination and your blood testing done. Don't ignore your health, because we know that if these cancers are caught earlier, the outcomes are very good. So please stay healthy. Thank you.